So we'll move right along. I'm presenting the results of a different project, looking specifically at the experiences of undocumented women who were pregnant and had children without status. It's a sub-project of a bigger project. You see there were a lot of people involved there, and this project was focused on access to healthcare. So the bulk of this overall project was analyzing the hospital files to identify people, that, women and children that were trying to gain access to healthcare services while not having RAMQ, the Quebec health insurance. I was part of a sub-study that was doing qualitative investigation specifically with women, not just who were uninsured, but who were undocumented. So just to make that distinction, there's a lot of people who have legal immigration status in Canada, but still don't have health insurance. So lots of studies are looking at the non-insured. This is a subgroup looking specifically at undocumented and uninsured. So we were able to do semi-structured interviews with 18 women who were in this situation. They came from a variety of countries of origin. The majority were from the Caribbean, but we had people from other areas too. They were, unsurprisingly, in the reproductive age range, but they'd been living in Canada undocumented for anywhere between 1 and 15 years. They all shared having very low income and therefore work being really an essential part of their lives. So if you look at the literature in Canada and internationally on pregnant, uninsured or undocumented women, it is really overwhelmingly from a medical perspective. Almost all of the literature is published in medical journals, and it's looking at aspects of access to health care, so just getting perinatal health care, and the medical outcomes. What are the implications of having children when we don't have medical insurance? In the US, there's a huge literature on this that's not necessarily about migration, just about lack of insurance, but that's really where this is focused on. However, there's another body of literature in the occupational health and safety realm that looks at pregnancy and work, and it's really been documented very clearly how important a woman's work situation is during pregnancy for her own health and the health of her child. It's just a major social determinant of health no matter what. However, putting together work and lack of health insurance, I didn't find any literature on this. So in this study, which is really very limited, we decided to have a look at what happens to the work lives of these women when they become pregnant. So just to sort of give an overview for people that aren't familiar, how do these women become undocumented? The majority of the people in our study were just visa overstayers. So they came to Canada on tourist visas as students and ended up staying past the end of their visa, therefore becoming undocumented, basically because they, in their assessment, return to their home country was not viable. Either just economically, they knew that they had nothing to return to, they were going to be in economic destitution if they returned home, whereas here they could at least have some form of employment. Or often also it was a personal thing where, in a positive sense, they had entered into relationships here in Canada, had a partner, had lives here now, or sometimes they were fleeing negative personal situations in their countries of origin, and actually quite a few of them had stories of conjugal violence that coming to Canada was a strategy to escape that conjugal violence. There were also a subgroup of refused refugee claimants who had unsuccessful claims for a whole range of reasons, some because you would really question the judgment that was made, others because it was maybe not a great choice to choose the refugee system given what their problem was. But again, having failed their claim, they become undocumented and it was not viable for them to return. So these are women who really feel that they need to stay in Canada. So what's their life like? The number one reason why people are here is to work. So again, we shouldn't be taking the work out of their experience of having babies. And given that these women are completely ineligible for any other form of income support, their work is essential. This is not something they're doing because they want to, advance their careers. They need it to survive. They have a high degree of independence in their lives. Most of them did not have extended family. Their partners were not often able to provide any kind of economic security for them either, because they're in the same undocumented situation, or because of couple dynamics that the partner was really not someone to count on. So they're living with extreme economic stress, really from, we can't even say check to check. It's a chunk of cash to chunk of cash. It was hard for them to maintain their housing and all their expenses. So any health care is out of pocket. Anything they need, they're having to pay cash for. And their family relationships in Canada and even internationally are very strained by the situation, because as we saw in the last presentation, many people did actually have children in their countries of origin that they were trying to send money to, or they had older parents who don't understand how precariously she lives economically here. And within couples, economic strain was really intense. So what were their work lives like? A few of the women in our sample reported that they were working through placement agencies in manufacturing and light industry, packing, that kind of stuff. But most of them were working in private households. They were working as house cleaners, caring for children, caring for elders. And so they were really having a direct employment relationship with an individual in a private home. So it's a very individual experience without any colleagues. They're having cash remuneration, no benefits, and a real dependent relationship with the employer. So it's, again, a very intense relationship, and the personal relationship is very important. Having to get along with the employer when you're the only person there and you depend only on that one person is very important. There were quite a few stories of abuse at work, wage theft, just not getting paid and continuing to work hoping that the pay is going to come through later, sometimes like intermittent pay, not for all the hours. Stories of real direct racism and harassment in the workplace, being treated with a complete lack of respect and dignity, but feeling dependent on that job, needing to stay. There were a number of stories where the employers were promising to sponsor them for immigration, because when you're doing domestic work in a private household, there is the possibility for, there's immigration programs that can help people to become permanent that way. So that was often like kind of carrot that employers would use for years with women, saying, oh yeah, we'll do it eventually, we'll do it. And in the meantime, they're working for below minimum wage, hoping this will come through and nothing happens. There were also a number of stories of agencies, whether placement agencies or recruitment and immigration type agencies, that were collecting fees from women with the same types of promises. We're going to help you regularize your status, and never doing it. And when you're undocumented, all the regular recourse for these types of violations just don't apply. There's no clear legal right to use the CSST or the like labor standards or occupational health and safety boards to protect your rights in these things. Or in the case of agencies with fees, there still isn't really a very clear regulation of this. The IWC has some success in helping undocumented people go through the labor standards and occupational health and safety thing, but it's really on a case-by-case basis, and there's no guarantee it's going to work. So what happens when they have babies? So just to say, these women, their lives go on. They're living here. They have a normal life in other respects. They have relationships. They have families and leisure on the weekends and stuff like this. So they're working age and they're reproductive age, and some of them have children. So the pregnancy can be for a range of reasons. Some of them are really choosing to have children in the context of a relationship where they're trying to build a family. Others, it's an unplanned situation, but a choice that they want to continue having the baby. But other women, it's unplanned, and they have, just to point out, their reproductive choices about getting pregnant or staying pregnant are also limited by their lack of access to health care. So in terms of birth control, they really pretty much only have access to condoms or other natural methods. If they want to have an abortion, it's very expensive and it's difficult for them to access. And when they are pregnant, getting access to prenatal care is all on a cash basis. And what would normally step in when working women are pregnant, they would have prenatal care. But like I said, in another study we did as a follow-up to this, very low access. Around 40% of the women never get any prenatal care. They just go to the hospital and have the baby. If they do get it, it's being paid by cash. But there's other prenatal care that's available from CLSCs and from community groups in terms of helping women with healthy nutrition during the thing, dealing with things like morning sickness, just learning about what it means to be pregnant. And they have a very difficult time accessing that. Although it doesn't usually require a health card, it's still difficult to get into that system. The big one, though, is preventive leave. Quebec has a pretty good program of preventive leave for women that are working in dangerous occupations during their pregnancy, and many of their jobs would qualify them for this, but they are not eligible. And then maternity and parental leave, these are based on contributions prior to the birth of the child, and because they're undocumented and working for cash, they have not paid into this, they cannot access that. And for women who didn't even have enough contributions anyway, they would have had access to welfare, but they don't have access to that either. So all of the usual protections are absent for these women. So what happens is they keep working, and they keep working in difficult situations. So most of them tried to work right up until the day of birth of their child, sometimes in extremely difficult situations, and they described it as being really awful. So 14-hour days, heavy physical work, and especially for those that, I didn't mention with the private employers, some of them had like multiple employers doing 2 different houses a day, 5 days a week, so 10 different days. That means in every single workplace she's in, she's using chemicals for the cleaning. So there's increasing stuff coming out saying that just your regular household cleaning products are dangerous to your health. And it's one thing if you're in your own house using them once every 2 weeks, depending on what your standards are, but these women are using them all day, every day of the week. So it's dangerous, yet they have no choice but to continue. If they were in a formal role in these types of roles, even dealing with elders who have Alzheimer's, who maybe have a risk of violence, if they're working in childcare situations, nursing homes, some of them were in those type of situations, they would have had preventive leave. There are also a lot of cases of women being just fired because they're pregnant. The employer doesn't want an embarrassing pregnant lady around the house, or an agency also doesn't want the responsibility for pregnancy on their in their workplace. There were a few stories of the employer being helpful in trying to mobilize resources for the woman, referring them to their doctor friends and stuff like this, but they were not very common. And it was really an extremely stressful time for the women going through that. And as they were pushing themselves to work as long as possible and maybe even put some money aside, they were very aware that the actual birth would mean being unable to work at least for a few weeks and unsure what's going to happen afterwards. So when they did have the baby, as in terms of care, postnatal care was pretty much totally absent for these women, except for the visit from the CLSC nurse that every new mother gets in Quebec. And also to point out that many of their babies were not covered by Medicare either, because even though they're citizens, their access to Medicare depends on the parents' access. So if both parents were undocumented or uninsured, the child would be also. So this was another level of stress for them. And if their child had any kind of medical complications, that was very difficult. They had no income support, and in most cases, their families were not able to support them during this time. So there was basically a lot of cases of hidden homelessness and food insecurity. So losing their homes, having to move in with friends, or with a partner that maybe they weren't in that type of relationship before. They have to go and stay with a partner that wasn't really a stable support before. And food insecurity, talking about not having enough to eat in the postnatal time. So most of them felt the need to return to work as soon as possible. And usually we're talking within 2 weeks or something if they could health-wise manage that. That being said, childcare was a huge hurdle. Most quality daycare is either subsidized or expensive and private. That was not an option for them, so they're forced to rely on informal arrangements. So neighbors, friends, so that can sometimes be a nice, caring environment, but they don't know, and they're not always sure it's a source of real pain for people to feel that they weren't able to provide their children with something that they were really secure about, and so early. Some of them worked in workplaces where they were able to bring their baby to work. So generally, this is someone who's working in a private home where the employers were not home during the day. So they would just bring their baby with them. Sometimes the employer wouldn't know about this, and other times would know and accept it. There were some, though, that were really unable to work because they weren't able to secure any kind of childcare, and this left them in an absolutely dependent and precarious situation. Like, none of them, it was because they had a partner or a family that was able to cover their needs while they were at home. So the implications to think about, there's increasing research and concern in the public sector for undocumented pregnant women, but it really is focused on their access to health care. And kind of cynically, it's often more driven from the concern for the babies that are going to be born that are going to be citizens, and a feeling like, oh, we're going to be responsible for them, so we better make sure their mothers are healthy during the pregnancy so that they're not sick babies. And even if we're sticking with this cynical view, you know, if we're not going to recognize the human right to health care, most of these women end up eventually becoming residents and being able to stay. So there's just, in a public health long-term perspective, on top of the basic human right perspective, there's a good argument for saying they need health care. But it's not just health care. They need work protections. Work is essential in the lives of undocumented migrants. And a lot of these problems are related to the lack of recognition of their work as legal work. If we don't find a way for undocumented workers to have access to labor standards, health and safety protections for all workers, regardless of whether or not they have a work permit, it allows employers to exploit them, and it leaves people like this in this situation where a system is depending on them, but we're not providing protections to them. The child care issue is coming out more and more. We're hearing it lately from refugee claimants, where there's been a rollback of eligibility for child care to refugee claimants. Here, this is undocumented, but if we reduce access to child care, that means we reduce the employment options for people who are in this precarious status who don't have the full access to the other protections they need to work. And we need to think about how we're creating all these categories of people that find themselves as undocumented workers, and it's related to the complexification, I don't know if that's a word, of our immigration system, creating more and more categories of people in precarious status, and just basically helping people fall out of status. And the numbers of undocumented people are growing. Yesterday I was in a presentation where someone from the city of Montreal quoted 150,000 undocumented people in Montreal. So that's the city of Montreal working with that figure. No one has the exact figure, but that's a lot of people. And so if we continue with this system, here's a subgroup where it's really extreme. We see the problems with them falling through the crack, but it's a problem in general that we need to deal with. So thank you very much.